There are many YouTubes discussing the topic of how much dental implants cost, but the reason that you've come to this educational platform is to learn about the critical information that nobody else is sharing with you, and that is vital so that you can make the correct decision with your best interest at heart. I'm an implantologist with 30 years of clinical experience, and I've placed and restored 16,000 implants. In this video, we will discuss important factors such as dental implant costs, bone classification, and aesthetic considerations. A scientific comparison, which nobody else is doing, of the value between motor vehicles, mattresses, and dental implants. And finally, strategies of how to save on dental implant treatment, including staged approaches and seeking treatment abroad, while ensuring proper implant brand selection and technical compatibility. Our goal is to discern the truth from media hype and present you with scientifically backed information. Your time is precious and your health is invaluable. Thank you for investing your time with us. The cost of a dental implant can vary depending on a number of factors, such as location, complexity of the case, and the materials that are used, and typically ranges between $1,000 to $4,000 in the United States and between $850 to 3,400 euros in Europe. Obviously, additional procedures and materials will incur extra expenses, and let's discuss this briefly and in very simple terms. We classify two types of bone in the human jaw: alveolar bone, which is the bone that surrounds and supports your teeth, and then basal bone, which is the actual jawbone, because the function of the alveolar bone is to support the teeth. If you extract teeth, then this bone slowly is broken down and absorbed over time, and we have a fancy term for this called resorption. By way of example, this would be a model of a patient who has lost a tooth, and the bone that is immediately adjacent to the tooth is called the alveolar bone, and the bone much further down is called the basal bone. Therefore, if an implant has to be placed in a particular area and there isn't sufficient bone to support that implant, then a bone graft may be required. This is one of the principal reasons where additional consultations, sedation, and other procedures and materials may contribute to the overall cost. We will discuss this in more depth and how to save money on bone grafting in episodes 118 of the Patient Education series. Another area where additional costs will unfortunately be incurred is in what we call the aesthetic area. And this is generally the front of your mouth, basically the visible teeth that are in your smile line. When these teeth need to be replaced, additional diagnostic tests and procedures are necessary. Simply put, as a comparative analogy, if you are building a house, you will pay a lot more attention and invest a lot more on the front door of your house versus the entrance door to the barn at the back of your property. Exploring dental insurance coverage for implants can be complex due to variations in policies. I'll make it a point to highlight the significance of reaching out to patients' dental health insurance providers. This step is crucial for you to understand the extent of the coverage that they offer. Now let me reveal an effective yet simple approach to navigate this process. In dentistry, every procedure is outlined using a specific code. For instance, in the United States, current dental terminology called CDT codes are employed, while different coding systems are used in various European countries, such as the unique system utilized by the NHS in the United Kingdom. Armed with this knowledge, it is advisable to proactively contact your dental insurance provider in advance to inquire what is the specific codes associated with a dental implant procedure and the corresponding coverage that they provide for that particular service. For example, code D6010 pays $3,133. Once armed with this crucial information, you can proceed to the next step. Reputable dentists will furnish patients with a comprehensive written treatment plan. This plan encompasses the various services involved and their associated costs. Armed with both the insurance coverage details and the treatment plan, you can effectively calculate the projected out-of-pocket expenses. This empowers you as a patient with a clear understanding of what to expect financially. And obviously, it also allows you as a patient to shop around. After exploring the intricacies of cost, let's redirect our attention towards a profound notion of value. How can we measure the value of an improved quality of life and extended lifespan? Let's address these concrete aspects. How can we determine the monetary value of a better quality of life, particularly when compared to the costs of a typical car or a standard mattress? Let's engage in a scientific analysis, drawing parallels between motor vehicles, a sleeping mattress, and a dental implant, to reveal some candid truths. In the United States, the average cost of an automobile is about $37,000, whilst in Europe, it falls within the range of approximately 20 to 30,000 euros. When it comes to daily driving, statistics reveal that the typical American spends about 57 minutes behind the wheel, whereas their European counterparts approximately 30 to 40 minutes a day doing the same activity. Shifting our focus, let's consider a common analogy and contemplate the realm of sleeping mattresses. These essential pieces of furniture span a price range between $100 to $2,000. Meanwhile, the average adult dedicates approximately 7.5 hours each night to sleep, equating to approximately a third of their entire life. For those fortunate enough to have experienced the slumber on a latex mattress, the profound comfort it offers speaks volumes. The transformation in sleep quality is truly remarkable. In fact, the unparalleled satisfaction derived from a good night's sleep on a luxurious, comfortable mattress tends to outshine the allure of piloting an extravagant motor vehicle. In essence, the value proposition of a restful night's sleep on a superior mattress far outweighs the splurge on an opulent automobile. I would like to emphasize that there is significant evidence to support the notion that maintaining good oral health, along with retaining complete set of teeth in the latter years, is strongly correlated with an increased probability of reaching the remarkable age of 100. The repercussions of losing multiple teeth by the age of 65 should not be underestimated, as this could elevate the risks of heart disease, diabetes, and osteoporosis, thereby negatively affecting your overall lifespan. In light of this, it is a judicious decision for individuals who are 65 years and older and have encountered the loss of multiple teeth or even the entirety of their teeth to seriously consider replacing these missing teeth. If you are currently reliant on a full denture, I highly recommend exploring the option of securing it with dental implants. This proactive step will facilitate proper mastication and enable you to broaden your dietary choices, including those nourishing foods that demand more thorough chewing. Moreover, your digestive system will be better equipped to absorb essential nutrients, allowing you to enjoy a healthier existence. By opting for this approach, you will not only experience an enhanced quality of life, but also regain the ability to socialize without the nagging fear or embarrassment of your denture dislodging unexpectedly. Ultimately, this holistic transformation will grant you the opportunity to savor life more fully. Simply put, dental implants are considered a long-term investment due to their durability. Proper care can help implants last for many years or even a lifetime. We will discuss this more in depth in episodes 37 and 41 of the Patient Education series. How can anyone even put a value to having years of life, and how can you even put a value to having a better quality of life? In conclusion, there are hundreds of companies and organizations offering financing options to help manage the upfront costs of treatment. That being said, I'm an old practitioner and notoriously conservative, and I live in the real world, and we look at things slightly different. And over the decades, we have advised patients on some tricks and strategies that allow them to save money and to reduce their out-of-pocket expenses without in any way compromising the quality, longevity of their final treatment. So here are some closely guarded secrets that nobody else is sharing if you live in the real world. Now, although in an ideal world we would like to have everything we desire at once, there is another option, and we refer to this as a staged approach. Some people refer to this as a staggered approach. Here is an analogy. If you are going to upgrade your home, you have a few options. You can either do it as a one-step procedure from beginning to end, if you have enough savings. Alternatively, you can adopt a staged approach. So you look at how much savings you have and you decide to, for example, paint your home this year. And then you save up some more, and in the following year, a few months later, you decide to do some landscaping, etc., etc. So you spread the work out over a longer period of time and slowly see the improvements while still reaching the same end goal, but by not overextending yourself. Now let's share a real example. I have consent for the patient, who I'm about to show you a model of. Now in this particular case, the patient did not have any of her back teeth. And so we had a conversation, we discussed an option of a staged approach, and we decided in one sitting to place 5 implants, 1, 2, 3, 4, and 5. Now the patient had a premolar on this side, but had a missing premolar on that side. So in the first year, we placed the 5 implants. In the second year, we replaced this implant with 1 implant supported crown, and then the patient at least had her smile line completely closed, so there would be no visible gaps. The year after that, we replaced this quadrant with an implant supported bridge, and finally the year after that, we replaced this quadrant with a final implant supported bridge, and she had restored her entire occlusion. Another secret strategy which patients in the real world sometimes adopt if they are living in a country where dental implants are very expensive is to find a reputable dental practice abroad, obtain a written treatment plan, and then have the work fully or partially done abroad. Here is some solid advice if you are going to do this. Firstly, calculate what the total cost will be of the workflow, including hotels and flights, because typically in more advanced procedures, you will require to go 3 or 4 visits. And sometimes there are technical delays, and this is obviously a manufacturing process. I also advise patients, if you are going to adopt this technique, then always spend a few more days after you have completed the treatment in the foreign country to double check that everything is okay and that you can eat, clean, and talk properly before you return home. Now obviously dentists in countries where treatment is very expensive don't want you to do this as a patient or to adopt this process for a variety of reasons. But one of the most important things is to ensure that if you decide upon this cycle of action, or on this workflow more specifically, to ensure that you carefully select the brand of the implant that you are going to have fitted. And here is some vital advice. There are over 900 companies around the world manufacturing implants. For long-term success, it is paramount that the implants that are placed in your jawbone need to receive the same brand of restorative components, which we refer to as abutments and abutment screws. I cannot stress enough how important this is, because if you use non-genuine factory-made components to be placed onto these implants, the accuracy and the fit will not be the same, and you may run into much bigger technical problems in the long run. I have previously discussed this in much more depth, and this crucial information can be found in episode 2 of the patient education series, and I will provide the link below. So check that the implant system that you are going to have fitted abroad is available in a practice in your hometown, because in the event that technical problems in the long term unfold for whatever reason, or due to any cause you are unable to fly back to the location where you had the original work done, then at least you can have the treatment completed in your hometown without any drama. One final advice point in relation to the specific topic. Because every implant system manufactured around the world is different, they require tools that are very specific and have each got their own specific settings that are unique to every implant system. So if you arrive at your dentist in your hometown with a technical issue with your implants that require mechanical intervention, for example, a loose implant abutment screw, your dentist will be unable to assist you if he doesn't have the specific tools and if he is not familiar with the technical requirements of that particular implant system. The golden advice that I always give to patients is to keep your detailed implant technical records with you, including the brand name, the model number, the lot number, the size, shape and style and location in your mouth. You can then jump onto the internet and search up the brand and see if it is available in your home country or in your hometown. Please be advised that we will delve deeper into these topics in the subsequent episodes of the Patient Education series, specifically in installments 12 and 21 of the Patient Education series. If you find the content valuable, we encourage you to like and subscribe and help us expand this educational platform. Remember that the path to good health lies in evidence-based scientific research. Stay tuned to our next podcast where we will dive into the topic, does dental insurance cover dental implants, and provide you with valuable insights.